Hello. Today I will be presenting cardiovascular flow analysis results stimulated using our computational fluid dynamics service, iTSimulation. This patient had a stenosis in the coronary artery, causing a decrease in coronary perfusion volume. We stimulated using computational fluid dynamics to look at various potential surgical options. To do so, we extracted the geometry of coronary arteries and 3D modeled a potential bypass grafting surgery, adding 3 different bypasses to the aorta. The 3 bypasses tested include the saphenous vein graft to the right coronary artery, the left internal thoracic artery to the left anterior descending artery bypass, and the saphenous vein graft bypass to the circumflex branch. We'll look at several key measurements to determine simulation results, including streamlines, wall shear stress, pressure, and flow rates within the coronary arteries. Streamlines depict the flow patterns of blood through the aorta, providing a snapshot of flow patterns during different cardiac phases. The velocity of the blood is represented by different colors, helping clinicians identify health issues within patients. 3 different scale magnitudes are shown, allowing us to focus on different streamlines. These are streamlines scaling from 0 to 0.5 meters per second. These are streamlines scaling from 0 to 1 meters per second. These are streamlines scaling from 0 to 2 meters per second. Wall shear stress measures the tangential force exerted by the blood flow on vessel walls. High wall shear stress can be caused by high energy loss or turbulent flow. There has been research done in the past stating that too much or too little wall shear stress increases the chance of cardiovascular disease. Similar to streamlines, using different magnitudes for the scale allows us to focus on different areas of wall shear stress. This is a map of wall shear stress from 0 to 10 pascals. This is a map of wall shear stress from 0 to 20 pascals. This is a map of wall shear stress from 0 to 50 pascals. The oscillatory shear index reflects the change in wall shear stress over one cardiac cycle. This allows clinicians to observe regions with fluctuating wall shear stress, and research says is a potential predictor of areas prone to disease. This is a map of oscillatory shear index from 0 to 0.2. This is a map of oscillatory shear index from 0 to 0.5. Pressure within the coronary system is crucial for assessing the success of the bypass graft. Our data shows stable pressure gradients across the grafted sites, indicating successful alleviation of previously obstructed blood flow. This is a map of pressure from 20 to 60 millimeters of mercury. This is a map of pressure from 60 to 100 millimeters of mercury. The flow rate of the right coronary artery is presented in this graph. The average flow rate is 57.2 milliliters per minute in the atrioventricular nodal branch and 93.7 milliliters per minute in the right posterior descending branch. The flow rate changes through different parts of the cardiac cycle. Similarly, the change in pressure over time in the right coronary arteries is graphed here. The atrioventricular nodal branch has an average pressure of 88 millimeters of mercury, and the right posterior descending branch has an average pressure of 76.5 milliliters of mercury. Like the flow rate, the pressure also changes over time in the cardiac cycle. In the left coronary arteries, 4 different measurements were made. The left anterior descending artery, the largest coronary artery, has an average flow rate of 87.6 milliliters per minute. The diagonal artery had a flow rate of 54.1 milliliters per minute. The first septal perforator artery, 65 milliliters per minute, and the second perforator artery, 48.6 milliliters per minute. The overall shape of the graph is similar to the right coronary artery's graph. The pressure in the left coronary arteries is 49.9 millimeters of mercury in the left anterior descending artery, 86.7 millimeters of mercury in the diagonal artery, 70.5 millimeters of mercury in the first septal perforator artery, and 54.7 millimeters of mercury in the second septal perforator artery. The shape of the graph also shares similarities with the right coronary arteries. Continuing to examine the left coronary arteries, 2 additional arteries were analyzed. The left posterior descending artery had a flow rate of 76.7 milliliters per minute, and the posterolateral branch had a rate of 89.3 milliliters per minute. Finally, the left posterior descending artery had a pressure of 68.8 millimeters of mercury, and the posterolateral branch had a pressure of 79.6 millimeters of mercury. Overall, the results across all coronary arteries show good outcomes that allow for viable flow rates and pressures. In order to calculate the flow and pressure fields in the coronary arteries, we use boundary conditions. It is important to model the aorta since the blood flows to the coronary arteries from the aorta. The inlet condition is shown here, along with a graph depicting the flow rate through the highlighted space at a point in time. As the heart contracts, the flow rate will increase and then decrease. The outlet boundary condition is shown here, along with a graph depicting pressure through the highlighted spaces at a point in time. As the flow rate increases, the pressure in these areas will also increase. The pressure at the outlet is set to simulate heartbeat. Resistance can be determined by dividing pressure by flow rate, and it is a measure of what needs to be overcome for the heart to pump blood across the circulatory system. The outlet boundary condition for resistance is shown here, with a graph describing resistance at different points in time. This simulation used several programs listed in the table presented here. Information related to the simulation setup is listed here. These are the references. In conclusion, our detailed analysis using iTSimulation provides comprehensive insights into the effectiveness of coronary artery bypass grafting, showing significant improvements in flow dynamics and pressure stabilization across the coronary system. This presentation encapsulates detailed analysis of cardiovascular dynamics using state-of-the-art cardioflow design simulation, offering insightful results that will help in assessing and planning surgical interventions.